Fibrocystic disease of the breast, or it is also called mammary dysplasia or fibroadenosis, and it is also called famous abbreviation called ND, and we will know within a few minutes what is ND. We will start by a small knowledge in physiology. Effect of hormone on the mammary gland. Effect of hormones on the mammary glands depends upon the level of hormone, level of female hormone, mainly estrogen, and the distribution of hormonal receptors in the mammary gland. It was found that the distribution of hormone receptors are variable from one breast to the other. There may be more receptors, more hormone receptors in one breast more than the other. There is variability in the hormonal receptor in the same breast. There may be hormonal receptors more in one quadrant of breast, or there may be more hormone receptors in localized area in the breast. At the end of the menstrual cycle, the level of hormones are high as much as possible in adult women. And this is a manual simple drawing for the mammary gland: acini, lactiferous duct, fibrous stroma. At the end of the menstrual cycle, with high level of hormones, mainly estrogen, and under the effect of hormone receptors in this part. What is the effect at the end of the menstrual cycle? The hormones stimulate the epithelium of the acini to proliferate. Proliferation of the epithelium of the acini leading to increased number of acini, and this is called adenosis. And the hormone affect only the epithelial lining the duct. In the resting stage, the duct lined by single layer of columnar epithelium, but under the effect of high level of hormone at the end of the menstrual cycle, there are proliferation of the epithelial lining the duct, and this condition is called epitheliosis. The hormone also affect the fibrofatty stroma in between the acini and the duct, leading to increased fibrous tissue stroma of the gland. All these effects occur at the end of the menstrual cycle under the effect of high level of hormones. After menstruation, the level of hormones drops, and all these cyclic changes which occur monthly disappear and return to the normal resting gland. Return to the normal resting gland, this condition is called involution. Return to the resting stage, involution. And in any woman, these cyclic changes occur in each menstrual cycle. At the end of the menstrual cycle, under the effect of high hormone, adenosis, increased number of acini, epitheliosis, ducts becomes lined by many layers of epithelium, and increased fibrous tissue. And this condition usually occurs physiologically and normally. After menstruation, return to the normal maximum within 1 week, and all these changes disappear and we return to the normal, means involution. All these changes occur in adult woman from puberty to menopause in each menstrual cycle, and usually silent, without any complaint in this female. But in some women, the level of hormones may be higher than normal, or the receptors in one breast, or the receptor in lobule, or the receptor in localized areas of breast may be exaggerated, leading to exaggeration of these cyclic changes which occur in female, leading to some sort of exaggeration of the normal development which occur in the end of the menstrual cycle, and the exaggeration of these changes will form a disease called fibrocystic disease of the breast, or fibroadenosis, or ANDI. What is ANDI? Definition of this disease is aberration. Aberration here means exaggeration of normal development, exaggeration of normal development of the breast which occur at the end of the menstrual cycle, at the last week of the menstrual cycle, in which the hormones reach the maximum level, and involution of the breast. If you take the first letter from each word, aberration, normal development, and involution, the famous abbreviation of this disease, which is ANDI. What is the etiology of this condition? Unknown. But is this disease actually exaggeration of the normal physiological changes which occur in the mammary gland in each menstrual cycle, or pregnancy, or lactation? What is the pathology of this condition? The pathology of this condition may affect the whole breast, or may affect the lobule in one breast, or may affect a localized area. How? According to the hormonal receptors in the area. If this breast containing excessive hormone receptors, it will affect one breast. If the hormone receptors are excessive in one lobule or one quadrant of the breast, it will affect this quadrant or lobule. If the hormone receptors are exaggerated in this area only, it will affect this localized area of the breast. And the pathology is actually proliferation of the epithelial lining, the acini, and the increased number of the acini, which is a condition called adenosis. Proliferation of the epithelial lining, the ducts, which is called epitheliosis. And if the condition is markedly exaggerated, proliferation inside the duct will produce some sort of duct papillomatosis. All the affected duct will show papillary projections similar to duct papilloma. Due to epitheliosis, where is the lumen of the duct? The lumen of the duct may be obstructed, and we all know there is increased fibrosis. Increased fibrosis will maybe compress the duct, leading to obstruction of the ducts. And if there is obstruction, the secretions will accumulate in this duct and proximal acini, leading to retention cysts like this. Retention cysts. Due to obstruction of the ducts with formation of multiple retention cysts. The fibrosis may be localized in localized area, leading to indurated mass, which should be differentiated from breast carcinoma. And the cyst. The cyst may be formed and becomes a large cyst. If the cyst is formed, what is the structure of the cyst? Any cyst containing a fluid. The fluid may be clear fluid, which is the normal secretions of the mammary gland in non-lactating females. Non-lactating females secretes minimal capillary fluid. This fluid may accumulate clear fluid or maybe yellowish serous fluid, or hemorrhage inside the cyst may occur containing blood or blood tinged, and alternation of blood inside the cyst may become green, brown or black discharge inside a fluid inside the cyst. The cyst is lined usually by epithelium. Because this retention cyst, the fluid will compress the lining epithelium, and usually the cyst lined by flat cells. And around the cyst there is fibrous tissue layer forming the wall of the cyst. Outer fibrous layer lining columnar or flat epithelium, and the fluid inside may be clear or serous or blood or altered blood. The cyst may become like that. Large cyst and bluish in color. This bluish color is actually the blood vessels in the wall of the cyst, giving the cyst the bluish coloration. This is called large cyst, which is bluish in color, is called blue domed cyst of bloodgood. Bloodgood is the name of a person. Bloodgood also describe a famous operation in hernia. The bluish discoloration may be due to altered blood inside the cyst. In hemorrhage in a cyst, altered blood may give this brown, the blue color. But actually this blue color is the blood vessels outside the wall. And if the cyst in fibrocystic disease becomes large and bluish in color, it is called blue domed cyst of bloodgood. What is the complication of this condition? Hemorrhage inside the cyst, or in this cyst the fluid is stagnant, stasis, and you all know that there is a golden rule in surgery. Any stasis in any fluid in the body may be complicated by infection. This epitheliosis, if epitheliosis is exaggerated, marked epitheliosis with marked hyperplasia, with cellular atypia, atypical changes means precancerous condition. And if we describe accidentally cellular atypia in fibrocystic disease, this patient should undergo regular examination and follow up to detect any development of carcinoma. What is the clinical picture of this condition? This normal physiological changes usually occur in every female before menstruation and disappear after menstruation. And this condition is usually symptomless, silent, without any changes. For some females, due to high level of hormone or high level of hormone receptors in the mammary gland, this condition may be exaggerated, leading to the main presentation is fibrocystic disease is mastalgia, which means breast pain. This main presentation, the patient complaining of dull aching pain or sense of tightness or sense of high pressure inside in the breast just before menstruation, in the week before menstruation, but the condition is relieved spontaneously after the end of menstruation and within 1 week after menstruation. The patient also noticed that there is abnormal changes in the size of the breast. The breast is enlarged before menstruation, and this enlargement disappears after menstruation. The patient may notice abnormal breast lump, which disappears suddenly. Abnormal breast lump increase in size, which means the cyst actually, before menstruation and disappear within 1 week after menstruation. There may be nipple discharge. Nipple discharge, which may be anything. If the duct is opened, all these changes disappear and the fluid passes through ducts, there may be any discharge, clear or yellowish sera discharge or green, brown, black discharge. Breast examination. The most important thing in this breast is characterized by nodularity. Felt by the fingertips, never felt by the flat of the hand. As any normal breast tissue. The normal breast tissue is felt by the flat of the hand, not by the fingertips. Please, palpate your breast by the flat of the hand. Normal breast, not felt by the flat of the hand, but felt by the fingertips. And fibroadenose, like the normal breast tissue, exaggeration of normal changes in the breast tissue, felt by the fingertips, not by the flat of the hand. And these nodules may be slightly tender, firm, and these nodules actually you feel the cysts under your fingers. If you ask this patient to come to you 1 week after menstruation and you examine the breast, all this nodularity, all this tender disappear after menstruation. What is the investigation for fibrocystic disease? No investigation usually is needed. It is a simple disease diagnosed clinically. If there are suspicious cases, as usual, digital mammography, ultrasonography, which will differentiate cysts from solids. Sure, ultrasound will show multiple cysts in this breast. If there is large cyst, under ultrasound, fine needle aspiration cytology. And sure, this is a benign cyst. It is benign because it contains clear fluid. The fluid is a cyst or the swelling disappear completely after aspiration, and the cyst does not recur within 2 weeks. And the aspirate, if examined histologically and cytologically, no malignant cells. Therefore, benign cyst can be considered benign if containing clear fluid, not blood stained. The fluid is sucked and the cyst disappears completely. No recurrence within 2 weeks, and cytology is free. In suspicious cases, excision biopsy may be rarely needed. What is the treatment of fibrocystic disease? Most of cases discovered accidentally without symptoms. No symptoms, no treatment. For mild symptoms, conservative measures. What is the conservative measures? If pain start to occur or discomfort start to occur to the breast, support the breast and elevate the breast by tight breaths and reassurance, sedation and analgesics. Prolactin inhibitors improve most of the cases as Barlodel or Ducentex. Cases with atypical hyperplasia should be instructed to form regular self-examination and regular follow-up to detect any malignancy if occur. Very, very rarely, cases with severe symptoms or suspicious malignancy or large cyst, excision biopsy as lumpectomy and excision biopsy to exclude malignancy. This is a fibrocystic disease of the breast. Thank you for good listening and good luck.